Causes of breathlessness. Causes of breathlessness are of two types: cardiac causes and non-cardiac causes. Cardiac causes are of two types: acute, and it also occurs in chronic cases. Non-cardiac causes are respiratory causes and other causes. Respiratory causes are of two types: acute and chronic. Other causes also include acute and chronic. Now we will elaborate them. In case of cardiac causes, acute causes are acute myocardial infarction. Number 2, acute left ventricular failure. In case of chronic causes, number 1, chronic heart failure, and number 2, myocardial ischemia. Respiratory causes includes acute and chronic causes. Acute causes include acute exacerbation of COPD, then acute severe asthma, pneumothorax, then pulmonary embolism. Finally, inhaled foreign body. Chronic causes include COPD, not acute exacerbation. In case of acute causes, it is due to acute exacerbation of COPD. Then chronic asthma. Number 3, massive pleural effusion. Lung cancer. These are the chronic causes of respiratory system, and it occurs breathlessness. Finally, other causes also include acute and chronic two states. Other: acute and chronic. Acute causes include metabolic acidosis, such as diabetic ketoacidosis, then psychogenic hyperventilation, that means respiratory alkalosis in case of panic attack, psychogenic hyperventilation. Chronic causes include severe anemia and obesity. So if we summarize the topic, causes of breathlessness or dyspnea are of two types: cardiac causes and non-cardiac causes. Cardiac causes are divided into two types: acute and chronic. Acute myocardial infarction, acute left ventricular failure. In case of chronic cases, chronic heart failure, myocardial ischemia. Respiratory non-cardiac causes includes two things: respiratory and others causes. Respiratory causes includes acute and chronic two states: acute exacerbation of COPD and acute severe asthma. These are also the causes of chronic respiratory system, but not acute. Pneumothorax, then pulmonary embolism, inhaled foreign body. Chronic causes includes also massive pleural effusion and lung cancer. Other causes include acute and chronic in two states. Acute states includes diabetic ketoacidosis, psychogenic hyperventilation, and chronic causes severe anemia and obesity. This is the photo of acute myocardial infarction, where there occurs a block in the coronary artery, and it causes muscle damage. Block in the artery, and it causes muscle damage. Next, in case of heart failure, there is enlarged ventricle, and it is the chronic causes of breathlessness or dyspnea. Then pulmonary embolism, there occurs there is a embolus, there is formation of embolus in the pulmonary pulmonary artery. Next there is a of massive pulmonary effusion. Massive pulmonary effusion is full whitening of the right lungs. Massive pulmonary effusion is the respiratory causes of breathlessness. Then it is the picture of it indicates lung cancer spreading. It is a spreading cancer. This is also a chronic respiratory causes of breathlessness.